let me just start by reminding you, all of the local behavioral health boards and commissions are advisory boards and commissions. So your action is to advise, to make recommendations. So our association is here to support you in that work. I'm going to go through a couple of different documents that guide in terms of how to review and then how to make recommendations. And these are suggested processes. But reviewing behavioral health local offerings, that's part of your duty according to state law. And then we'll touch on the behavioral health continuum document that we've put together. It's a short summary of all of the different pieces in the behavioral health continuum. And then we'll move into discussion. And that's my favorite part, where we just hear from you, and you're welcome to share issues, challenges, gaps, and barriers that you see in your local communities, and then also successes. And we use that information in order to determine our priorities as an association each year, and what kind of issue briefs or speakers we have, as well as legislative or policy advocacy. Okay, so for those in the room, we have documents here related to this training. There's, and these were in the materials page for those online. So the review document is the first one we'll be taking a look at. It's kind of lavender, lilac, I'm not sure what you call this color. And then kind of a buff pan for recommendations. And then in yellow, we have the behavioral health continuum. So we'll be looking at all three documents, and we will start with the review document. All right. So in terms of reviewing and evaluating, remember that you are experts in your own experience, and that experience is valued and important, and one of the reasons why you were appointed onto your boards and commissions. So we want to respect that, and we want you to respect everybody else's experience and backgrounds. People are experts in their lived experience, or their experience as providers, or family members of the community, or folks that are in sectors that intersect with behavioral health. And we want to have all of those perspectives and knowledge and experience inform the system. But this slide shows suggested areas that you would look at when you're reviewing and evaluating the offerings or needs within your community. The first one, accessibility. We recommend looking at, are the services culturally relevant? Not only take a look at the penetration rate, how many people are accessing services from different cultural, ethnic, or racial groups, or LGBTQ, or justice involved, or children and youth, different age groups. Is it culturally relevant to them? In order, you can look at access points. Are they actually ever taking a service? Are they taking a second service or a third service? Are you able to engage them and keep them in services if they need them? And then also, what are the outcomes of those services? Is it helping? Are they effective services culturally? Or, a lot of times it's important to look at both. Not only are you actually giving access to services, but are they working? And if they're not working, and you see it for a specific sector or racial, ethnic, cultural group, then you know that that's an area that your agency needs to focus on and find ways to improve their services. So that's culturally relevant. Scaled, is it scaled to meet the needs of your community? Some of our counties are huge, so geographically it needs to be scaled. Sometimes it needs to be scaled so that it's in places where people are, maybe their primary care, where they're receiving the most care. It needs to be, I'm moving into integrated, but that does help scale the programs too when primary care physicians are trained in behavioral health. So integrated are the services where people are, and then communicated. That can mean do the signs in front of a facility, make it easy for people to know where to go. Say they're coming for a crisis stabilization service, and they can't find the room they need to go to. That's a big issue. And so, that's one thing to look at, is the signage good? And that can be something that you make recommendations on. It could be, some of the agencies advertise in local media their services. They'll put it on buses, big advertisements on buses, billboards, just making sure people are aware of their services. And there's many, many more ways to do that. Recommended practices include practices that are client and family driven, where peer providers are an essential component. Clients and family members are treated with dignity and respect and included in decision making. Program leadership and staff includes people with lived experience and family members. So those are some of the recommended practices. And then we have links to our website to give you definitions and information on evidence-based practices, trauma-informed practices, and community-defined evidence practices, which are practices that are defined by different community, racial, ethnic groups, and there's LGBTQ plus as well, that they've found from different community-based organizations around California. They have evidence to show that their practices are helpful to improve mental health outcomes or behavioral health outcomes. Number 3, sustainability. Are programs financially viable? Something to be watching for and asking providers about if you're doing a site visit. And then workforce sustainability as well. And then looking at performance, looking at what are the life outcomes of people that have received services. Okay. Any questions on this piece? I see some items in the chat. Make sure that we're not. And then go ahead and come off mute if you have a question. All right, let me move to the next slide. In terms of issue identification, I'm giving you an example of what we do. I've done this in a few different counties, and some of them do this on their own without my help. Every year they'll try to identify what are their top issues. We have we have 34 different issues on our website. And it's not practical to work on every single one of them every year. But it's nice to have, say, maybe your top 3 issues that you care about. So we have a short presentation that you can access on our website just to see, the kind of frames how to do goal setting based on your different welfare and institution code duties, but also how to identify issues. And so this on the screen is a picture of one of those big sheets of paper that you can stick to a wall. And we brought different colored stickers. They're a little dark on the picture, but I think they were green, red, and blue, and wrote 1, 2, and 3. So I think green was the ones, blue was 2, and red is 3, something like that. So we could find out what are the top priority issues for the Behavioral Health Commission or board members, and they could stick the stickers on. So all this list came from them. And then after each of the members told the group what priority issues they would like to see the board or commission work on, after they were all written down, then everybody was given an opportunity to press their stickers onto the board so you could identify what the major issues were. Here it looks like if the green, if I'm correct, and that was number 1, that's probably the homeless integration with behavioral health was their number 1 issue. You can see by this that I cut off part of the paper. A lot of times people need to understand that a behavioral health issue is something specific in terms of a challenge or a gap or a barrier related to behavioral health. And without having this type of goal setting model to them, they might throw out things like our goal is to get more performance information from staff, or our goal is to do more site visits. Those are good things to do, but those aren't actually issues that they've identified. So I cut off a couple of things and then put these types of issues that they could actually look at and say, yeah, we could do some things here in order to move forward with advising on these issues. So let me move to the next slide.
Teresa,
yeah.
Where's the goal setting presentation on your website?
It's under resources. There's a resource tab on the website. Okay.
I'm looking at a copy.
Yeah.
Is it
yeah,
there?
There's a copy. Yeah. This presentation right here, you could get to it that way as well. This is in the materials page from today. All right, so I'm going to go to the next slide. All right, so once you've identified issues that you want to work on, keep in mind that you're an advisory board or commission and you advise the governing body, usually the board of supervisors, and then you advise the local behavioral health director as to any aspect of the local behavioral health program. So the first thing you would need to do if you're going to make recommendations is identify. What we just talked about in that last slide, that was one way of identifying. But a lot of the things on this item 1 here are influencers, to help a board or commission identify top issues. When public comment, listening to what the public is bringing up to you. Second, performance outcome data. Third, presentations by staff. You're always probably getting presentations by staff at your board and commission meetings. You might also be inviting patients' rights advocates and contractors, advocacy groups sometimes will come and present. And sometimes it's folks from outside of behavioral health that would come and present if they're in a sector that intersects with behavioral health. So identify, and then have liaisons as the last item here. So your board and commission members could be encouraged to be on other boards or commissions or attend other committee meetings in the county or committees that are run by the Behavioral Health Agency. And that's a way also to be more knowledgeable about topics and be able to identify. The second item, so once you've identified what you want to make a recommendation about, we provide some tools for researching. So research that topic. Ad hoc committees can be helpful if you have members that you think would be interested in working together to conduct research meetings. We have page 3 of our best practices guide, and that's the best practices handbook. I've got a few of them in the room if anybody needs them. This handbook we will mail to you if you like. It has a number of different resources in it. If you want it in printed form, we're glad to send it. And there's a page on ad hocs that helps to define what an ad hoc is, to keep you in line in terms of being able to run an ad hoc without having it as a public forum. As long as it's less than a quorum and it's short term, it's okay to have work groups, and they can meet, they can talk by phone, they can be on teleconference. They don't have to post their meetings, and they can work on items. So they could be doing research in terms of the research meetings, but also just looking at documents together, having discussions with each other, and possibly moving forward with either like an issue brief on that issue or just a recommendation, a proposed recommendation. The chair could be meeting with the behavioral health director also and asking for information about that. And it's the chair usually that interacts with the behavioral health director or staff, but they could ask for, mention we have a work group. Could we have maybe some suggestions on members of staff that we could talk to about this? And go through the chair though and make sure that it's okay, and they could be introduced or brought into contact with the ad hoc or short-term work group. And then site visits are a good way to do research as well. And then move into advising, draft recommendations. If you have an executive committee for your board or commission, it's usually best to have them review a draft recommendation first before it goes in front of the full board. Have it vetted through the executive committee, or if you don't have one, at least through the chair, and then bring it forward, put it on an agenda for one of your meetings, and take a vote. And if your board or commission supports that recommendation, then it becomes a tool as well to help you advise. Okay. And let me go back a moment and just mention, in terms of recommendations, we have a few that have been shared with us. We're starting to see more and more that some of the boards have gotten their footing in terms of doing recommendations. Sometimes we'll see them appear in reports from different committees that they have, or annual reports, we'll see it there. And we're glad to share those with you if you need examples. Okay, so before we move into the discussion, I want to mention the document, the Behavioral Health Continuum document. We have it here in the room, and I can pull it up on the screen. Yeah, let me pull it up here. Just a second. And I'll zoom in a little bit for you. Okay. So just to give you a short overview of what's in the behavioral health continuum, and this is a short overview. There's a lot in a continuum, but we start on our page here is we start with engagement tools, including peer staff. So we recognize that's an important component. And engagement tools that are comprehensive, culturally relevant, and the outreach as well. And then shared decision making, psychiatric advance directives. We put that in there because we feel like that's a very important tool. Court ordered care and conservatorship are certainly engagement tools, but more as a last resort. And then comprehensive community services that are accessible, integrated, recovery-focused, trauma-informed, culturally relevant, and have significant use of peer staff. And we have a listing here that, again, is not comprehensive, but we're saying, there's a lot of sectors involved. That includes housing, and then in the areas of mental health and substance use disorder, we need to include prevention and early intervention, psychosocial services, peer support, medication management, crisis care, and hospitalization. And that one's definitely as a last resort as well. Physical and behavioral health integration, public guardians and conservators who are appropriately trained and have manageable caseloads, substance use, and behavioral health integrated services, and then vocational and behavioral health integrated services. So there are requirements now in terms of the vocational piece to provide that because of the Behavioral Health Services Act. We know that the employment can be a very important therapeutic tool and a very important piece of wellness for a lot of people. And then third is interagency collaboration. So collaboration between crisis care programs, emergency services, hospitals, jails, law enforcement, prisons, schools, and behavioral health departments, public and private. And that's not a comprehensive list either, but that's a lot of the sectors. And then we point out the importance of information sharing, discharge and aftercare plans, and warm handoffs. Okay, and I won't go into the second page, which touches on the funding for all of this, but on the right side of the first page, we have issue briefs that we've put together related to areas where we've seen either great needs or challenges or barriers and gaps. And we've either gotten information from issue briefs that were created locally in the counties, or they've been statewide or federal papers that we've just kind of condensed and reduced into summary pieces that point out key components, recommendations locally, and recommendations to the state sometimes as well. So I wanted to give you all that background